Welcome to another episode of Girls Who Gab with Habs and Muffy. On this episode, we're talking about something we all have opinions on. Our doctors, our dentists, and whether anyone in a white coat is actually listening. This one's called Doc, are you even listening? Because let's face it, we've all had that moment. You're lying under a paper sheet, making awkward eye contact with a ceiling tile and thinking, did she just interrupt me to talk about her dog? Or you're in the dentist chair, mouth open, drowning in suction, and they ask, so how's work? We're pulling no punches, talking about the good ones, they exist, the gaslighters, the ones who still don't believe women know their own bodies, and yes, the orthodontist who somehow turned your kid's braces into a 5-year mortgage. So if you've ever left an appointment wondering, was that normal? You're not alone. You're one of us. And your copay definitely doesn't cover the amount of venting we're about to do. Doctors and dentists. Wow, what is there not to talk about? I mean, no, I'm not going to spend this episode bashing doctors or dentists or anything of the like. I think there's some great doctors out there. I think there are some okay doctors. And then there are others that I'm like, wow, how have you been able to continue in your practice? I once had a doctor say to me, I went to them because I was having an issue. And they were like, oh, you haven't been in like 4 years. Oh, now you're coming because you have a problem? Like, that's really not going to help the situation and the communication. I mean, doctors shouldn't talk back to their patients. I had another doctor say to me, like, oh, I was telling them that I felt my stomach was bloated and whatnot. And I was like, it's like, I'm pregnant. She's like, oh, well, I do know I'm pregnant too. And I was like, that's really not okay. To say that. I mean, I don't like doctors that are judgy. I do like doctors that are willing to go the extra mile. They're curious. I mean, isn't that why a lot of people get into medicine? Because they're curious and they want to help people? Maybe I'm wrong. I mean, maybe it's just for the money. I don't know. But, here's an example. When T was born, we ended up having to keep her in the hospital for a little over a week because she had some test scores come back that were a little subpar, and so they weren't ready to release her. So she didn't stay in the NICU, but it was somewhere in between the maternity ward and the NICU, and her oxygen levels were dipping all the time. And I mean, it was kind of upsetting. I mean, she wasn't on the brink of death, but there was definitely something going on. And they couldn't figure it out. She kept going for various tests, and they couldn't pinpoint anything. Now, it happened to be over a weekend where this very inquisitive younger doctor was just like, I need to solve this puzzle. And she was able to hear something in the test that no other doctor had heard. And she identified that T had a hole in her heart. So, it's people like that you're like, thank you. Thank you for your empathy. Thank you for your curiosity. Thank you for wanting to like understand and like those people. I think there was something recently on the news about a baby who was in like a life and death situation, and these doctors wanted to try this new genetic treatment, and they were able to like, connect all the dots. I'm not a doctor, so I'm not going to try and explain it. But, the parents took a risk by letting the doctors figure out the formula that was going to help their child. Now, their child got a lot better, and they got sent home after a year. But, not that this child is out of the woods per se, but those doctors, they wanted to help. They wanted to, solve the scientific question of what was wrong with this child. Now, I'm not saying that every doctor or even dentist needs to be this amazing, outperforming person, but I, as you know, I have a long history with doctors and a long relationship from when I was born until now, and, it's been very complex. I mean, for the most part, so, as I mentioned before, I have this congenital birth defect. It's called an omphalocele. I mean, most of the times, doctors are just like, "Oh, wow, that's so interesting. Can I examine?" And it's like, "Yeah, yeah, whatever, just," Or other times it's like, "Oh, are you always in a lot of discomfort?" I'm like, "No, not really." I mean, this was when I was younger. Now it's changed a little bit, and I also think it's changed, for women as we get older, like, for all that we and talk about, women's health care being subpar, we're still there. As much as prominent women have talked about healthcare that women need, we're still back at ground zero, which flabbergasts me because I I mean, how much do we have to speak up before, changes are made? I mean, I still think the value of a woman's health is far below that of a man's. And I'm not a feminist per se, but I do think that to be true. And I think it gets worse as women get older. I think they lose their voice more and more, and I don't know how that is. Um, if there's like, I think we talked about on our motherhood episode, you know, a lot of the focus for doctors treating women in their, I don't know, 20s, 30s, 40s, it's all about childbirth, not about all these other things that might be going on. It's not even on their radar. So it's frustrating. And it's frustrating because I think, I'm one when I go to the doctors, I want to talk about everything. I'm going to spill the beans about everything because I want that doctor to know everything that's going on because I think there's a relation to all the different things going on. I don't just want to talk about one thing. I also want my doctor to hear me. If I have a concern about a specific thing, I want to be heard. I remember one time I was asking a doctor, like, well, I think maybe, I'm very anxious, etc. And I'd like to explore going on an antidepressant. And he was like, well, but let's figure out this other stuff right now and then we'll address that. Like as if my mental status was going to go away or could be put on hold. I finally did get a doctor to prescribe one to me, and it changed the world. I mean, even my husband noticed a humongous change. I wasn't angry anymore. I wasn't having outbursts. Personally, I wasn't anxious. I mean, I don't think, the range of emotions with women, especially with our hormones, it changes so much through so much of our lives. And we often just get laughed at. Oh, that female's on her period. Oh, that's why she's acting this way. Or, oh, that woman's pregnant. Oh, that's why and so on. And then when you go through menopause, they're just like, nobody understands why you're acting that way because they think you should have gotten over it all because you no longer have your period and you're no longer of childbirth age. Anyway, I'm going off on a tangent, but I find it I find it very difficult where you are in the world to find good doctors. Now, I have to say, we have incredible hospitals, research centers, and doctors on the East Coast. However, I would say that, like, even in more urban or suburban areas, it's really hard to find a good doctor. I mean, and surprisingly, in New Jersey. I mean, I'm close to Philly, I'm close to New York, but still, a really good doctor around here is hard to find. And you'd think I mean, I think most people would be surprised, but I also think there's a lot of people who would vehemently be shaking their head, yes, in agreement. As you and I have talked, a lot of it has to do with where people are trained as doctors and kind of the healthcare mentality. Both you and I have found that on the West Coast, um, doctors trained out there are much more integrative, looking at the whole person, not just solving one problem or another. Let's check a box here, let's check a box there. Now, I mean, I did encounter a few doctors that I didn't particularly love. I remember I was having a problem with my back, and this one doctor was like, "Well, you just can't exercise anymore." And I was like, "How is that a solution?" But I have to say those people were kind of few and far between. And I'm not saying the doctors out there are wonky and they only believe in holistic medicine, but I think they were just, I think they just tend to be a lot more open-minded. And yeah, maybe they would recommend other types of therapy, but I think when they were, I felt when they were evaluating me or even my girls, they were looking at a number of different factors and trying to really integrate all of those considerations into whatever they felt was the next right course of action. So again, I don't want to pit East Coast against West Coast. It is a different style. Some people enjoy being just a little bit more straightforward and head on. I mean, I know my husband he just wants to go to the doctor, be seen, and get out. But even he would agree the health care that we've received on the East Coast versus West Coast has been very different. And we both, looking at our experience living on the West Coast, we both prefer that experience, generally speaking. For an example, he had this thing on his finger, and he went to a couple of different doctors, and they were like, "Oh, it's this or it's that," or "Oh, you can't do anything." And then he went to like a dermatologist for something, and he showed the doctor his finger, and they're like, "Oh, it's just like a cyst." And he just popped it, and it all just like, all the fluid just seeped out, and it was fine. It was like, hello, why could no other doctor identify what was a really simple problem and a simple solution? I don't know. I'm not saying every doctor, physician, expert needs to, have all of these tools. I just think sometimes that the way some speak to their patients, especially women, are inappropriate and insensitive. And um, I don't know. I kind of feel like I'm often being talked down to. So, but I also acknowledge there are those like experts. For example, she had to have open heart surgery before the age of 2. And she had a surgeon who was and probably still is, if not higher. He was like the 4th top surgeon in the world. And he wasn't a man with a lot of emotions, but he was straightforward, he was honest, and he got the job done. So I also appreciate that type of physician or doctor. Oh, when it comes to dentists, I don't know. I think it's a different playing field in some respects. I growing up, we had fine dentists, but they weren't great. And my family aren't known for having great teeth. So I did have to get braces. And my parents sent me to the orthodontist that does braces in the town I grew up in. And it seemed okay. He actually ended up doing a horrible job. And I finally got my braces off like freshman year in college. And then a few years later, I was like, the guy gave me like buff teeth. So I went back to a different orthodontist in my 30s, and the guy told me that my alignment of my upper teeth to my lower teeth were off. Sorry, I'm struggling with a cold today as I record this episode, but they were off by a whole tooth, and that was because of the prior orthodontist, the work that he did on my mouth, as well as all the teeth they took out of my mouth as a child. So they actually took out too many teeth. And that was really painful. It was really hard to do in my 30s. I was newly married. I had to have a permanent retainer on my upper mouth on for almost 8 months. And the day that I got it in, oh my God, it was so painful. I couldn't even talk. And even after that, I was really like self-aware in public and at work whenever I had to do a speaking piece in a meeting or like a presentation. I had a terrible lisp, and it was just really hard. I was really self-conscious. I mean, at the end of the day, he did a great job and they came off, but man, that was a lot. It was a lot and it was painful. And I mean, why I think I had braces on for almost like 7 or 8 years. I mean, isn't that crazy? So, speaking of dentists, A actually found a dentist out in California. Man, that dentist, she was super nice, very thorough, knew her profession very well, but that was a boutique experience for sure. I mean, every time you went to get a cleaning, they would numb your teeth, and I'm like, "Okay, this is a little much." Like, I just wanna get my teeth cleaned. Like, I don't need to have my mouth numbed so you can do this deep cleaning every 6 months. It just my teeth don't require that. And it did not matter how much I flossed, brushed my teeth, it was never good enough. Again, she was super pleasant and friendly and a lot of fun to talk to, but I could never do a good enough job. And I think that's another thing about like doctors and dentists, that relationship. Like, you know, you're people too. And, as doctors and dentists, you don't always make good patients. So, hey, let's give a little empathy to your patients. I know I've been a little bit critical here, but I've had a lot of experiences, good ones and bad ones. So I think that's been reflected in my my thoughts about doctors and dentists. What about you, Muffy? Love to hear your opinions and views and perspectives.
Oh, halves. The topic of doctors and dentists, near and dear to my heart. And I have to say my heart because I married RK, a doctor, a radiologist, in fact. And it was funny, at my wedding, a friend of mine came up to me and she said, "Oh, I'm so glad you found your doctor." And I said, "What do you mean?" She's, "Yeah, because all the time you were dating," this is when back in my DC days, she's like, "all you said was you wanted to marry a doctor." I said, "I did?" And she goes, "Yes." She goes, "You wanted to marry a doctor." And she goes, "And I was wondering, why would you want to marry a doctor? Wouldn't you want to marry a hedge fund guy or a international business guy or somebody? But you were set on getting a doctor." And she goes, "And you found your doctor. I'm so happy for you." And that always made me think, in fact, I did want to marry a doctor. I don't know why. I think I maybe know more about that now, which is that I wanted a medical doctor in my family that I could trust implicitly. Because I feel that doctors are sometimes not to be trusted. Or as you've been kind of talking about in your voice memo, how it's hard to know, like, are you getting the truth about something? Are you getting the right story? Do you need to be worried? Do you need to be concerned? And I thought, I find a trustworthy doctor. And let's face it, I married a radiologist, so they know every part of the body, right? They make the stuff that is unseen seen, right? So, like, we don't know because we don't see it. We know it's happening in our bodies, but it can't be something we understand. But if I was married to someone who could translate that for me, whom I trusted implicitly, then I was cooking. So I think it was very important that I actually marry a medical professional. And I do not regret it because over the years, I've had different little scan here. I haven't had major stuff, but I've had things. And, he will just look at those films or bring it up. And, luckily it's been, knock on wood, I'm healthy, but like, I can be really a little bit neurotic about things. And he will just be like, "Okay, here it is." Like I had a sprained ankle once. And okay, so I went to the hospital because I sprained it. We had to go to the little like urgent care or emergency room. And I had just sprained it and I hadn't broken it. So that was the big thing, was like, it was a sprain, not a break. But it was like it wasn't a doctor who read the film. It was like, I think a PA or somebody who did that. And, RK, the person delivered it, the PA delivered the news, and he said, "Oh," he was in the room with me, and he said, "Oh, can I just, have a look at that for a minute?" And she said, "Well, all right." And I don't really like doing that. I don't know if he revealed he was a radiologist or not. Maybe he did. So I just like to have a look at my wife's scan. And then he read it and he agreed, but there was a part of that scan that was that she missed something fine on it. And it was a teachable moment for him with her because PAs don't always have all the training. Of course, the radiologist has it and on the finer details. See, this is one of the problems. And he said, "Hey, pay attention to this part. Do you see what happened here? And, this is what we would call this." And she was like, "Oh my goodness, yes, I see that." He goes, "It's fine. You've read it correctly, but just the finer point on this is this." Oh, I was so happy I was married to a radiologist. I was like, yes, yeah. So I think there was something in my intention to marry a doctor and to find one of that who has served communities all over the world, and not in the biggest cities. He's often been in the most rural areas in different parts of the world, from Vietnam to Borneo to little Tweed Coast and in Australia, which is a rural town in Queensland that borders New South Wales, up to Edmonton, Alberta, into Seattle. I mean, he has served people all over, and I feel like his fine eye, his training has benefited so many people. And of course, it has benefited me. It has also taken my mind to another level as far as what I expect of providers. And also, I have a really good sounding board when I have something medical that I need. And, he will be there to think it through with me. And that's also very, very helpful. So, I guess I have the insight. I mean, you and I have talked, of course, the West Coast. We were on the West Coast for 17 years. I had a great PCP out there. Shout out to Dr. S at the Polyclinic out there in Seattle. She was great. I was with, she's about my age. And I was with her for the full 17 years, and it helped that she was of my age because she could know what I was going through because she was also going through it as well. I remember at one point, Dr. S said to me, "Hey, you can call me by my first name." Because, I think she was born in 1970 and I'm born in 1971. And I was like, "Doctor, I will never call you by your first name because you are not my friend. You are my doctor. And I am not your friend. I am your patient." And that's how we always must relate to each other. I liked her. I thought she was a nice woman. I knew about her family, because this doctor knew our case. It's a small world, the medical community. I mean, the medical community anywhere is a small world, but I knew enough about her personally. I didn't need to get into the weeds, right? I'm a therapist, so people tell me everything. I don't want to go there with my doctor, right? She was my doctor, and I kept that very clear. And I think people need to keep that clear. Once we start breaking down boundaries and become friends with our doctors, I think that's really a recipe for disaster. But she was very sound. You are right. West Coast doctors, I think, are very integrative. They look at the whole person in their approach, where I cannot even believe what I find here in New York City. Everybody's siloed. They won't, your PCP here can't even do like a pap smear because your OBGYN and some other office needs to do that. And there's all these territory wars between these specialties and these doctors. So you don't get holistic care. You get siloed care. And like, does anybody, a provider, actually have the whole picture about you? So, and I went through many interviews with doctors out here to try and find somebody who did look at the whole me integrative. And, sure enough, I found her on like the fifth medical interview I went on, and she's trained on the West Coast. So there you go. And she was funny. She's like, "Yeah, I can just do your pap smear every 5 years." I'm like, "Thank God." I'm like, "Come on." I think you're very right that women's health is not taken seriously at all. And we are told not to have a voice, that we have. It's like the old-fashioned days when Freud said, women have hysteria. I mean, we don't, that's an old-fashioned word, but it's kind of like that, right? If you go in there and you've got a, chronic pain issue, or there's something perimenopausal, or something, as you said, like an anxiety or depressive episode, it's basically like, this is in your head. Let's in for physical things. If you don't have anything physical, then you're like having hysteria. And you just need to go home and just relax and chill out. There's nothing wrong with you. I mean, it's awful, awful, often awful how women's health is treated and oriented around in this country. And it is changing a little bit, but not much. Actually, I don't think it's changing quite that much at all. I think it's great that celebrities are actually trying to, like, put a face on women's health, especially what's happening in menopause. Of course, leave it to Gen X to be like, "Hey, I still wanna be hot and sexy even though I'm menopausal." It's like, "No, we don't wanna go down quiet, do we?" But even then, I don't think it has much difference. I don't think it's changed much. There's a little bit more attention on it, but I think when you actually go to your doctor, it's the s you're met in the same way, and by the way, that's why I have never seen anyone other than a female. I will not go to a male doctor. I don't even know what I'd say to a male doctor. They don't know my experience as a woman walking on this earth or my body or my health, and so I have no interest in speaking to someone who doesn't walk in a woman's body. So that's just I've always been interested, like, women who have male OBGYNs who are delivering their babies, and I know I was delivered by a male OBGYN. It's like, what I don't understand, like, how women are comfortable with that. I don't know, but I know everybody is. I'm probably an exception, but I've always kept with female doctors, and I'm pretty particular about female doctors I go to. It takes a while to get there with your providers, that's for sure, and I had, a couple of years ago, a head surgery. It was more cosmetic than anything else, and luckily, married to old Doc RK, it was an odd thing. I had, like, bumps on my head I was born with and just grew and grew and grew. A lot of my skull was growing, and it was unusual. It's funny when you talk about your health issues that you were born with, this is, like, another interesting case for doctors, and you and I have exchanged how it's not great to be, like, a specimen to doctors. It's like it's kinda scary when they're like, "You're interesting to me." And RK really didn't know where to begin as far as who he would refer me to or suggest. And so he actually held off and, for years it was like, "Oh, we should do that overseas." And I was just like really scared. And I really wasn't ready to face what was really going to be a psychological surgery more than a physical surgery. The pain of that was going to be more psychological than physical. I think I knew that somewhere unconsciously, but I don't know. I turned 50 and I was like, I want to take care of this. And so RK, he does have a lot of ends to lots of different specialists. He called one guy who's an ENT guy, ears, nose, and throat, and was just asking him, "Hey, would you know someone? This is kind of the situation. This is what I need." And, he was an ENT, but he was also a general surgeon. And he was like, "Well, if it's not anything in the brain or it's just superficial," he's like, "I can do that. So why don't you get her a CT and then send it over? We can have a look and have a consult." Oh, well, we got in the office, and RK did come with me because he knew him. Dr. T, I'll call him. Um, he looked at all the images, and of course, RK is a radiologist, so they looked at him, and it was, like, very superficial, but fascinating, right? I had, like 50 of these things on my head, and I'm not kidding. It was crazy. And big ones and little ones and all these things, and, as you get older, your hair starts going wonky and maybe receding a little bit, so they're showing up more and more, and, yeah, I was fascinating to him, and he really wanted to do the surgery, but I had to figure out when I could take time off with my patients and all the things, right? So I was getting nervous because, a little bit of these bumps represented my trauma as a child. I'm not gonna go into all that right now, but they were like an object of my trauma. And I was saying this to RK. Of course, he's a physical doctor. He's not a psychologist or a psychiatrist, but I knew like there was much more going on in that surgery room, potentially than just a physical surgery. And I said, "Oh, I want to bring this up with Dr. T at my pre-op because we did schedule it." "Oh, I wouldn't do that," he says to me, my husband. And I'm like, "Why?" He's like, "Because, you're going under anesthesia. He's going to have all these tools, something, if you upset him, something." I'm like, "What?" So even he's aware, right? These doctors have, especially surgeons, have these egos that you sort of have to walk along. And I'm like, "Well, if that's how it's going to go, then that's awful." I said, "I'm definitely going to have to say something." He's like, "Oh my God," right? I mean, I'm going to have my mouth running about my head. Right? This guy's going to do something with my head that's like going to cut into my early childhood trauma. So I went in there for the pre-op meeting. You have to sign off that, if anything happens, you're okay with all the things, right? And we were talking, and I just said exactly what I'm saying here. "Hey, when you're in that room and you're opening up my head and folding down the skin, and that's all going to get exposed, you're exposing more than just these bumps that you're fascinated with, that are interesting to you. You're going to hold a person's trauma." That's going to be in the room. And I said, if you can't meet that and hold that carefully, you're not the person for me. Oh, he was, he's a surgeon, right? So he's like, oh, you psychologists and stuff and analysts are really in here. I'm like, no. I go, that's not what's going on. I'm not hysteria. This is my truth. This is what's going to be in there. And you need to hear it and you need to hold it, or I'm not doing this with you. You're not going to get your interesting specimen. Well, he calmed down and he said, okay, okay, kind of like placating me. And I kind of walked away like, I'm glad I had my voice, but I'm not exactly sure what's going to happen. So right before the surgery, right, the anesthesiologist comes in. I'm in my little gown there. I'm going to go in the room and the anesthesiologist comes over. RK is with me. Thank God I have my doctor. And he says, well, we're going to do this. We're going to do that cocktail. And I'm like, okay, is this okay, RK? And he's like, yes, it's fine. So, and then the surgeon came over, Dr. T, and he rolled his wheelie chair over and got right in my face. I will never forget this moment. And he looked me straight in the eye and goes, we're going to do this now. And I knew that he knew what he was going to be holding in that room and that he was going to hold that well. I just knew that. And in fact, he did. And all these bumps on my head, Habs, apparently he was trying to knock them off of some instrument. When this is what I'm under, so I'm not feeling it. But he finally said to himself, and he shared this with RK, he's like, oh, I stopped knocking her and I just smoothed it all out. And I mean, I really felt like that was him holding my trauma very carefully. I was also a specimen. Later on, when I had my post-operative meeting with him like that Friday, all these doctors came here and they were looking at me. And I'm like, wait, what's happening? And he's like, oh, yeah, they were kind of in the room with you and us doing this because they were like fascinating. You were a 1 in a million case. I know Habs, what that feels like to be told you're a 1 in a million case. Thoughts?
Muffy, I'm intrigued by your story about when you had surgery for the bumps on your forehead, where you woke up in the hospital room after the surgery and your doctor came in and all these others followed and you were like, wait, what's going on? What's happening? And that they were in the room when the surgery was happening. I mean, maybe you don't remember this, or maybe RK spoke on your behalf, but yes, I have been in a lot of surgeries. And I mean, I remember, in fact, one time I had to walk into the surgical room. So I had to get off the gurney and walk to the bed. And they showed me like there were all these people behind this window that would be monitoring certain things. But they also asked me if certain people could observe the surgery. Because I was having not open heart surgery, but I was having a non-invasive surgery, but it was in regards to my heart. And so every time that I've had something like, because I always have these weird surgeries, I'm usually asked, oh, can this person sit in on my, on my surgery? Or even when I had my colonoscopy, which wasn't successful, there was like an internist and the doctor's like, do you mind if she sits in on the surgery to observe? Like, no, sure, fine. I mean, I remember even, so I'm like completely numb to it all, to be quite honest. I remember one time when I was pregnant with T and A and I wanted to kind of go the extra mile to understand what kind of abnormalities or defects or whatever that our child might have because of my own condition. And they had to, like, essentially, this is going to gross people out. They had to go in and take a sample. And I mean, I'm awake, right? And of course, A sitting in the background, he can't see anything, but he's there, of course, he's passing out. Or at one point, the nurses were like, are you okay, sir? Like, they were never like, are you okay, ma'am? I was fine, but still, he was white as a ghost. But the doctor came in and he was like, oh, I have a teaching fellow. Would you mind if she came and watched? So I was like, yeah, sure, whatever. So I am totally used to that kind of stuff. Isn't that funny? I'm just so not bothered by it, so I readily agree to most anything I have to say. I remember when I was delivering Jay and some doctors wanted to do this test. I forget what it was, and they were like, "Would you be willing to do this?" I was like, "Sure, whatever." So I signed something and I'm happy to give my information away for medical research. And I mean, I'm just so used to it that it just doesn't really faze me. That's not to say I'm just gonna let anybody do anything. No, no, no. I just want to make that clarification. I am discerning, and I agree with you that it's that connection with doctors that really go a long way, that make it okay to do these things. Like the doctor that, removed your bumps. I mean, you didn't have that connection initially, but um you did have it. And I think you probably kind of deep down knew this was the right person. I mean, I can easily identify when it's not the right person. I mean, like, for example, the guy that did my colonoscopy, he was fine. He was fine, right? But he wasn't going to be good enough in the long run. So, I mean, I didn't end up staying with him. So I think it's so important to be persistent with the people that are going to take care of you, medically speaking. I love the fact that you interviewed 5 different doctors and you found the one on the fifth doctor. I mean, at least for now, that's kind of how I feel. I am willing to go far and wide and as long as possible to find somebody that is going to be the person that I need them to be as my doctor. And I agree, your doctor's not your friend. I completely agree with that. Now, I think you can have friends who are doctors, but they're not your doctors, right? I'm not going to have a friend who's my doctor. Um, I did have this, well, I still have this friend, but they've moved away. But I have a friend that was local and is a doctor. And it was always great to be able to just run stuff by him. And he would ask questions or say, oh, you should go to your doctor and ask these questions or have them do X, Y, and Z. So it's just like a little bit of oversight. So I find it fascinating that you always wanted to marry a doctor because you wanted somebody in the family to help you navigate the medical world. That's so interesting. And just to be like your spokesperson, your advocate. It's so important. And I think, it's hard when you don't have that doctor in the family I think it's more challenging for A and I to communicate our clinical stuff because we're not experts and we're not looking at it from that perspective. I mean, every time A goes to do a test, whether it's blood work or a colonoscopy, he always thinks he's dying. Well, I'm probably dying of cancer. That's what and I don't know how to respond to that. So clearly I'm not a doctor. Now, I think it's not the same thing, but I think about having lawyers in the family. Always good to have a lawyer in the family because you just get that expertise that's honest and raw. And whereas you don't always get that with people that are not in your camp. Or, I mean, that's why it's so important to have those medical people in your camp that you trust, almost explicitly. I mean, not 100%, right? Things go wrong. But that you are willing to put your life in their hands. As I reflect, I don't think I ever had a desire to marry a doctor. I mean, I didn't think about it until now, but I don't think I ever dated a doctor. I did one time. I dated an accountant, and oh my gosh, he was the nicest guy, but we went to see Good Will Hunting on one of our first dates, and that's a movie you walk out of, and you have a lot of discussion, you talk about it. And I asked him, what he thought about the movie. And he was like, yeah, it was good. And I pried a little bit more. Yeah, it was okay. Yeah, one-word answers. I'm like, "Okay, this is not somebody that I will be seeing again." Eh, A is so different because he does love to watch movies and talk about them and enjoy them, but anyways, I'm digressing. I did know that I always wanted to marry somebody who had a good sense of money because I did not. I didn't grow up with that foundation, and I knew I needed that. Now, I got that. Be careful what you wish for sometimes, right? No, I'm I'm serious. I'm happy that I got it, but yeah, sometimes, as we've both remarked in the past, A and RK take the money thing a little bit too far. Just saying. It's funny what we're neurotic about, right? Like you wanting to be married to a doctor, but also not wanting to take extreme measures if something happens to you. I wanting to marry somebody who has a good sense of finances, but yet now I want to be able to spend money and travel. And not that I can't, but it's just funny how these things kind of turn out or how they what we anticipate at the beginning isn't always the way or the course, but I still think we both got what we wanted. And maybe that makes us look like women who are hysteric. But I often think, you know, those that are the most crazy are the most sane and the most clairvoyant. So maybe our hysteria is not such a bad thing. We actually see the forest through the trees. I don't know. I just think it's funny that society, like, pegs women as being hysterical when the men are more hysterical in so many ways. They get so upset about things and they don't I know I'm going on to a male versus female, but, I mean, women know what they want and they're smart about it. Maybe they come across hysterical, but at the end of the day, they get what they're looking for and they've got a clear path and they're strategic and smart about that path that they're gonna take. So, yeah, I mean, I'll just end on saying I, for the most part, especially as I've gotten older, prefer female doctors over male doctors. However, I have had male doctors that I've really liked and have really had my back. So, less so, again, in more recent years, but I did have a great OBGYN 2 actually, who delivered both of my girls, and they were both fantastic, and they really put me at a lot of ease, so I know we all have our preferences, and there's reasons for it. I don't know, what do you think, Muffy? Are we hysterical or not? I don't think I care either way.
Just to clarify, so I had my surgery on a Wednesday and it was like outpatient surgical clinic where this happened. So it wasn't that serious. Um, as I said, physically, it was really a breeze and a cakewalk. It was more psychological. But Friday, I had the post-op meeting with him in his office. And that's where a couple of fellow colleagues came in and looked at the result. And we're like, this is amazing. And that's when Dr. T told me, oh, we had a few colleagues in to kind of watch or whatever. So he did not mention anything to me. I, they were kind of looking at me like that specimen way. But it was a couple days afterwards. I did not wake up with actually even Dr. T was in the room. No doctor was actually in the room. It's just the staff. They were waking me up and getting me out. So it was odd that he didn't ask for my permission for that. I really didn't care for what it was or whatever it was. It was actually more cosmetic than anything else, and he did a fine job. But yeah, it is kind of odd that he didn't ask me that. I agree, but it wasn't when I woke up. The funny thing about that surgery is RK is a doctor, but doctors are the worst with their wives having health issues. They just are. It's just kind of a running joke in the field. And RK, he wanted me to have the surgery because I wanted it finally. I'll never forget, like, I had all these crazy bumps on my head. And this Dr. T at some point was like, why didn't, RK just say to you, like, let's get this taken care of. You don't have to be like that, And I'm like, I was like, Dr. T, he allowed me to come to it. Like, if he would have said, like, "I want you to get that done," because this is more cosmetic than anything, it would have been like, "Don't you accept me for who I am?" And, but as a surgeon, he was like, "Oh," like, he's not, like, thinking about, like, being sensitive to one's wife or being accepting of their body for how it is. I mean, one thing about RK, he's really good at that. Um, he doesn't have any sort of, like, expectations of me being a certain way, which is a beautiful thing, and, when I finally wanted to get it done, he was like, "Okay, I want it because you want it, but not because I need you to change or have it look a certain way." He was just like, "I'll never get Dr. T." But, looking at me like, "Why didn't he just, like, tell you had to get this done and, like, help you?" And I was like, "Well, he did when I was ready. Took me a while to get ready. 50 years, but oh well, I got there." Anyway, it's just funny, this surgeon, as I think back on it. But apparently, this surgeon, Dr. T, was so excited about the surgery. I mean, he really was. He wanted to do the surgery. He did call me a one in a million case. He's like, "I'll never see another person like you." Anyway, RK was like saying to me, "I never would ever want to see you with your skin down and all of this exposed." He's like, I think he knows me and my trauma. He's like, "I don't want to see that." Well, what do you know? Dr. T gets done with his work or whatever, and they're finishing it all up or whatever. I think he's stitching me up actually, but then whatever, I think I was resting, so he runs out to the wing where RK is and says, "Wait, look at these pictures," and he shows RK all the pictures of all this exposed. All the RK was just like, "Yeah, thank you very much." And he's like, "You seem not as excited as I am." RK's like, Because that's my wife. I never really wanted to see her like that." He was clueless of why he wouldn't just have me go do that right away, like, right when he met me, and, like, clueless about not wanting to see me in that way. I mean, I was truly a specimen. Go for him. RK has those pictures, and I've never wanted to see them, and I think he might have even deleted them. I don't know if he still has them. So, it's just interesting. Yeah, I mean, I don't think I dated many doctors outside of him. Yeah. And I remember, it's funny, where this conversation's gone about doctors. I remember I didn't know RK for very long. We took 3 months to decide to get married. It was very much more of like an Indian arranged marriage. We arranged ourselves. And I remember thinking in those first 3 months, like, this guy is not always going to be a doctor. I could just tell, like, he wasn't that excited by it. It was sort of posed to him by his father because they were from Malaysia. And Malaysia is sort of an apartheid state favoring Muslims, and RK and his family are Indian, Hindu, and there really was an opportunity. If there was an opportunity to go back to Malaysia, he would have to be in his own profession. So his dad's like, be an accountant, be a dentist, be a doctor. I mean, they were like, you can be a professional and have your own practice, but you can't do business because you won't be favored in the nation. And, in the end, RK never came back to he never came back to Malaysia, but he stayed in Australia. But he still did what his father said. Sorry, I'm a little hoarse. Mhm. He ended up just deciding to be a doctor. But in those first 3 months, I just knew there must be some passion inside of him beyond medicine. And I remember thinking to myself, "Oh, around the 50-year mark when he turns 50." Now we're in our early 30s when I'm thinking this. I'm like, he will leave medicine. I just knew that, and I was like, "Okay, do I wanna be with a man who's gonna be a doctor his whole life? I'll be in a suburban house, I'll raise some kids, and that'll be our life, and we'll retire in that community, and that'll be it. Or do I want this guy who's sort of, really out there with himself, like, yeah, he's doing this, but, probably gonna do something else midlife." And I was like, "Oh, no, I want the more interesting person I am," because that was more interesting to me. Someone who's a doctor and has all of that, because I was very appealing to me, and also somebody who's just gonna be multi-talented and do something else. And lo and behold, 50 came for him, and he's like, "Well, I'm gonna take the golf." And I was like, "What?" was like, that's what your midlife thing is going to be? You're going to take up golf? Just like, okay, I remember thinking it that year. Yeah, that was like 6 years ago. I was like, wow, I got that wrong in those first few months. I'm like, how did I get that wrong? That's like a big deal. And then lo and behold, like 2 years later, we realized, or, that he really was just crying inside because he really wanted to be a stand-up comedian performer, something that he had hung up a long time before after he first tried it, like 15 years earlier. So no, it was there. It was just delayed by a few years, but and he's still doing his radiology, but he's also very much pursuing stand-up. So it's nice to be with somebody who's is not just a doctor, but also has other callings. I think that's far, far more interesting. Um, I'm glad to hear that you had good experiences with male OBGYNs. I think a lot of women do. I don't know why. First off, I didn't have a baby, but I don't know why I have such a preference for females doctors, but I do and always have. But yeah, I mean, I think that the field is dominated by men, actually. I think women are going into it more and more. But yeah, I mean, it's a funny story. My younger brother in my family of origin was born, and he came out of my mother smiling. He was really happy. And back in the mid-70s, when babies were born, things were just a lot more lax. And this brother of mine, he was a happy baby, and he was also like voraciously hungry. And my mother did not breastfeed. In the 70s, it was all formula. And the nurses came in at some point to tell my mother, like, we are not telling the doctors, but we are going to just feed him a whole milk because the formula is just not doing it for us. A whole milk at like 2 days old. Whole milk. And he was happy. But anyway, just funny about him thinking about the male OBGYN. The OBGYN who was my mother's doctor at that time was named George. And George was so taken with my younger brother when he was born because he came out smiling. He went to my mother and said, if you name your son George after me, I will pay all your hospital bills. I mean, who knows what it cost in the 70s to have a baby? Maybe it wasn't much. But anyway, my mother's like, thanks so much for that offer, but there's no way I could name my son George after. So my mother had an OBGYN named George who wanted my younger brother to be named after him. Yeah. So, I mean, my mother was very happy with that OBGYN. Really wanted my brother named after him because he was so happy when he met the world. And again, I still haven't said a word about dentists.
I'm not sure why it's the OBGYN practice is male dominated. That definitely makes me baffled, to be honest. But I do have to say, the doctor that delivered J and was my OBGYN for T, although he did not deliver her, he was very sympathetic and very on top of everything when I had concerns because I was having some back pain and I was worried about being pregnant and what that meant. And he laid all that to rest. So, yeah, I mean, I think it's hit or miss, to be quite honest. I love your story about your mom and Dr. George and him asking your mom to name her child after him. I mean, that's crazy. I mean, it reminds me of an episode from Friends where there was a doctor delivering, I think, Phoebe's triplets, which were actually her brother and his wife's triplets, like she was a surrogate. And he was obsessed with the Fonz from Happy Days. And he wanted her to call him Dr. Fonz. She was like, no. Like, so sometimes doctors are a little bit crazy. Let's just put it out there. But maybe they have to be just a little bit crazy. Like women who might be a little bit crazy. But it's all good. Because I think to be crazy means to be sane. What do you guys think?
Thanks for joining us today. Muffy's got dinner with Dr. Hubby to get to, and Habs is planning to lean into all that delightful female craziness doctors just love to diagnose. Until next time, keep on gabbing. For more, please visit us on Instagram at Girls Who Gab with Habs and Muffy. And please join us next week when we talk about dreams, dreaming in our dreams. Fascinating.